So probably one of the number one things to feeling better is getting your mind right. What do I mean? You have to have a good mindset. No doctor is going to tell you this, but positive attitude equals less pain. It's just been shown in study after study after study after study after study. So most of our surgical outcomes we now know are more heavily dependent on psychological factors or biopsychosocial factors, we say, than on our technique, our rehab protocol, or anything like that. So people with depression, people that pain catastrophize or make that pain is the biggest, most important thing ever. People that have fear of movement or kinesiophobia because they're scared it will hurt to move, and people with anxiety generally hurt more. And so if we could control these and get the mind right, get the mindset happy and positive, we know we can reduce pain. And in fact, ortho, even though we're about 20 years behind the rest of the industry, I think, in this world, our American Academy of Orthopedic Surgery key article this year for maintenance of certification and board certification talked about the psychological effects on outcomes of surgery. So even we are catching up. There's a scientist, Alicia Crum, who's written a lot about mindset and how important it is on even like serum markers get better if you have a positive attitude about things. So this isn't just tricking yourself. Like there's actual neural pathways in your brain that are improved that connect to the rest of your body with happiness, with mindset, with knowing or thinking that something's going to be good for you. So if you know, and I've given you why you should know that the Mediterranean diet is going to be good for you, and you participate in and you cook for your family and you're social and you're doing this, you're going to get better, as opposed to if you just do it by rote because, oh, my doctor told me I had to eat the Mediterranean diet, so I'm going to eat even though you're thinking to yourself, I hate it, I just want Cheetos. Nothing's ever going to work for you that way. This has been shown in physical therapy literature. This is shown in sports performance literature. You have to have a vision. You have to visualize, have good biofeedback, have a good mindset. So the only mindset plays in everything. So the placebo effect, that is mindset. It's important in physical therapy. It's important in drug therapy. Drugs only work if you think they're going to work. Surgery only works if you think it's going to work. There's a 30% placebo rate in surgery. We know 30% of people are going to get better because they feel like something was done that was major. Sleep, everything plays into mindset, family, friends, and this goes into what else? Stress reduction. Which means what? Your cortisol levels drop. You don't induce as much inflammation. You don't have as much of a mess up with your circadian rhythm. So you need to keep your cortisol levels where they should be. They should just go up in the morning, a smaller spike in the later afternoon / evening. They should never be high at night. Mindset's hugely important.